तस्य ज्ञानाञ्जनशलाकयः चक्षुरुन्मिलितं येन तस्मै श्रीगुरवे नमः। श्रीगुरु परमानन्द प्रेमानन्दफलप्रद व्रजानन्द प्रदानन्द सेवायां नियोजयः। नमो विष्णुपादाय कृष्णप्रेष्ठाय भूतले श्रीमते भक्तिवेदान्त स्वामीति नामिने। नमस्ते सारस्वती देवे गौरवाणी प्रचारिणे निर्विशेष शून्यवादी पाश्चात्यदेशतारिणे। जय श्री कृष्ण चैतन्य प्रभु नित्यानंद श्री अद्वैत गदाधर श्रीवासदि गौर भक्तवृंद। हरे कृष्णा 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 हरे हरे, हरे राम 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 हरे हरे। Om Tat Sat. So we worship the Guru. The Gita explains, Krishna explains that through worship of the Guru all blessings are sought. Om Jnanatinjandhasya Jnananjanashalakayah Chakshurunmilitam Yena Tasmai Shri Gurave Namaha. That's from last stage.
Yeah.
Om Shri Shuklam Varadaram Vishnum Shashivarnam Chaturbhujam Prasannavatanam Dhyayat Sarvavighnopashantay Shri Shri Guruvebhyo Namo Namaha. We have a special garland from the shrine from Krishna. Hare Krishna. I request you to please a small offering to Lord Dhatu, small tika from the forehead of the deity. Om Ishvara Parama Krishna Satchidananda Vigraha Anadiradi Govinda Sarvakaranakaran Sarvakaranakaran. चिंतामणि प्रकर सद्मसु कल्पवृक्ष लक्षावृतेषु सुरभिरविपालयन्तं लक्ष्मी सहर्ष शतसंभ्रम सेव्यमानं गोविन्दमाधिपुरुषं तमहं भजामि वेणुं गणन्तमरविन्ददलायताक्षं वरहावतं समसितं मुदसुन्दराङ्गं कन्दर्पकोटिकमनीयविशेषशोभं गोविन्दमाधिपुरुषं तमहं भजामि श्रीदत्तात्रेय देवाय नमो नमः। दीपं समर्पयामि दीपं समर्पयित्वा पुष्पं समर्पयामि श्री श्री जय दत्तात्रेय देवाय नमो नमः। Thank you. Request Radhamohan Prabhu, please, on behalf of the Hare Krishna Temple, Bhaktivedanta Manor, say a few words of introduction and welcome to Dr. Lad and everyone here.
I'll just speak for 2 minutes. It's an official welcome to Bhaktivedanta Manor, as you mentioned, for 2019 Ayurvedic seminar, especially our very special guest, Dr. Lad, but of course, just as much from our perspective, all of you as well. I hope that you enjoy your stay here as much as we will enjoy yours. Who hasn't been here before, rather? Wow, that's about nearly half. Okay, so I'll go for the usual stuff for you. This building was built in 1884, but was donated to the society in 1973. But this society itself has been here for 50 years now, ever since the days of George Harrison and John Lennon. It seems so long ago and yet so near to us. And during this year, we're actually doing some construction work, which is, as you'll probably see around, there's a 2,000 square metre construction project of a multi-purpose function hall and new facilities. Because as mentioned earlier, this is a great building, but it's a bit smaller, and we're expanding. So many people want to learn about Ayurveda and anything really from India. India's back in vogue, I think, is the word. We need it. We need spirituality in whatever form it takes. But so official welcome, of course. If you have any questions from people such as myself or Vaishnava throughout the next 4 days, please do so. So it'd be great. We're looking forward to you again next year, perhaps in the new Haveli, perhaps. Who knows what will happen. What can I say? Oh, you know about the 5 exits and the toilets, but just down here, there's the temple room. I don't know who hasn't been to the temple room yet, but that represents the spiritual heartbeat of our community with a beautiful shrine. And if you're here at 7 in the morning or 7 in the evening, we have candle offerings, which of course you can take part or just witness if you like. It's a very beautiful experience for many of us, and because it's the holy month of Kartik. So again, it's made even better by your presence here. So please bear with any shortcomings we may have due to facilities or drilling noises and things like that. But it's part of life, as an Ayurvedic specialist might say. Sometimes to make advancement, we have to make sacrifice. You have to take a step back to take 2 steps forward. Anyway, it sounds good, doesn't it? So anyway, don't go in the temple room at a time when, of course, the seminar's going on. I have to say that, otherwise I'll get in trouble. But please, whenever your spare time, lunch break or whatever it might be, please feel welcome to have a look around, explore the George Harrison garden or some of our gardens, and hopefully it won't rain too much. Welcome to England, those from abroad. Thank you, and Hare Krishna, have a good time.
Hare.
According to Vedic tradition, we begin any sacred work together with a chant. I will lead you, I will give you the melody, the meter, and you have received. Same, no? Otherwise I will chant different. And correct. This one. Prayer to Lord Ganesha, Saraswati and Guru. Om Gananam Tva Ganapati Havamahe Kavim Kavinam Upamashravastamam Jesharajam Brahmana Brahmanaspatana Shrunvanutivihi Siddhasadanam Vakratunda Mahakaya Suryakoti Samaprabha Nirvignam Kuru me Deva Sarvakaryeshu Sarvada Siddhi Buddhi Shakti Sahita Shriman Mahaganadhipataye Namo Namaha Nirvignam Kuru. Ya Kundendu Tushara Dhavala Ya Shubhravastramruta Ya Veena Shankara Prabhutirvir Devai Sada Vandita Samam Patu Saraswati Bhagavati Nisheshajadyapa Gurura Brahma Gurura Vishnu Gurudeva Maheshwara Guru Sakshat Parabrahma Tasmai Shri Gurave Namah Tasmai Shri Gurave Namah Tasmai Shri Gurave Namah. Ayurveda is an ancient Sanskrit word. Ayuhu means life and Veda is science. Actually, Veda means to know, with to know, and Veda become knowledge, the body of the knowledge. Ayurveda, the knowledge of life, and knowledge is science. Systematized knowledge is science. So Ayurveda became the science of life. Sattvam, Atma, Sharirancha, Trayam, Etat, Tridandavat. Sattva, the mind, Atman, the conscious principle, and Sharira, the physical body, together is life. So our life is a functional integrity between the body, the mind, and consciousness. This is a very profoundly spiritual system of healing. The ancient Vedic science of healing and bringing balance in our daily life, in our daily relationship with one another. And according to this science, every individual is indivisible. Individual is indivisible. Means undivided, total, unique expression of consciousness. So we all have uniqueness. That doesn't mean I am superior than you. No, it's not like that. Rose is a rose, lotus is a lotus, and bougainvillea is a bougainvillea. There is no comparison. Beauty of the lotus is unique. Beauty of the rose is unique. But lotus never complain, hey rose, you have thorn, get lost. No, they love. They are just spatial expression of life. Similarly, we individuals are like blooming flowers of consciousness. And we have to love ourselves as we are. Don't compare yourself with anybody who is higher, nobler, greater and bigger than you. What you are at this moment is a unique expression of consciousness. That uniqueness has to be understood. That's why Ayurveda talks a great deal about Prakriti. Prakriti is your constitution. Prakriti is your unique constitution. And Purusha is pure awareness. So our life is a blending of our constitution and awareness together. So this Purusha Prakriti expression into Mahat. And Mahat is cosmic intelligence. But on an individual level, Mahat may become your intellect. buddhi. So Purusha is choiceless, passive state of awareness. Prakriti is the primordial matter, and their first expression of creation is intelligent. And intelligent means to put everything in its right place. In the Mother Nature, there is a right place for the sun, the moon, the planet, the earth. In our body, there is a right place for the brain, for the heart, for the lungs, for the intestine, for the skeletal system. What a beautiful order is there within the creation of any being. So, within one DNA molecule, there is all the body of information. And that DNA carries our genetic code. That genetic code of DNA is Prakriti, the micro Prakriti, the cellular Prakriti. So Prakriti is recorded in every individual's DNA. That DNA is your blueprint, and that blueprint is your genetic code. If there is a history of tuberculosis in your family, you may carry that memory of tuberculosis in your DNA. And one day, those genes which carry the memory of tuberculosis, they pop, they express, they become active. And one day, person will get tuberculosis, rheumatoid arthritis, heart attack, stroke paralysis. Almost 99% diseases, they have root cause in genetic dysfunction, genetic predisposition. So genetically, we carry the cellular memory of our great grandparents. That memory is memory of happiness, memory of health, memory of ill health, memory of depression. That's why in certain family there is a depression genetically happening at certain age factor. So depression, when it is a psychological factor, it has root in Prakriti. Prakriti tvam nivakshasi means Prakriti will make you to act in a certain way. So, everybody has studied Ayurveda. I'm not telling you anything new. I'm just doing loud thinking in front of you. If you like it, cute. If you don't like it, still it is cute. Because we are sharing together, exploring together certain hidden secret. If you really listen to the speaker with a great love and affection, it will completely change your life. So this seminar is also for self-healing. It is not just collecting knowledge and information. It is more than that. It is digesting the information into wisdom. That is why we are meeting together, sharing together since last 15, 16 years here in this place. And every year speaker comes here and he has seen many, many old familiar faces, not by age but by time. And speaker is very happy to see you again. I do namaste to you. So, Ayurveda, Ayushaha, Vedaha, Ayurveda. Ayush means span of life. And Jiveda Sharadaha Shatam, Pashyema Sharadaha Shatam. Live long, happily for 100 years. Or more than 100 years. So 100 years is the normal span of human life. But very few people live that long. There is old age, disease, genetic factor, autoimmune disorder, wrong diet, wrong lifestyle. People are confused. They don't know what is good for their prakriti, what is good for their vikruti. And that is why we all are suffering from ailment, from disorder, from disease. Because we are missing what is our prakriti. Prakriti is your unique psychophysiology. Prakriti is your unique constitution. Prakriti is your unique nature. And we have to understand this concept of Prakriti. Ayurveda is not only philosophical science, but it is practical. The Mahat is intelligent, Mahat become Ahankar. Aham means I. Kar means farmer, I farmer. Ahankar. Akar means form. Ahankar means I farmer. In our body, every single cell has a form. RBC, WBC, platelet, thrombocyte, polymorphonucleoside, every white blood cell, every fibrin, every fibrinogen, they have, though they are chemical substances, they have form. And form is created by Ahankar. Ahankar doesn't mean ego. It is a biological need. Ahankar, many people translate as ego, and ego is a bad. It becomes egotistical. The actual meaning of Ahankar is expressing your being as a becoming. Expressing your being as a becoming. And becoming is form. Becoming is expression. Becoming is evolution. So in every single seed there is Ahankar. Mango seed has mango Ahankar. Papaya seed has a papaya Ahankar. And when that seed fall on the soil and there is enough water and sun rays and good fresh air, then Ahankar in the mango seed create a sprout. Then sprout grows into root downward. Then it becomes seedling. Then it becomes bush. Then it becomes tree. Then it becomes ramification, branches, leaves, flowers, fruit. Again back to the seed. So this is a journey of Ahankar, of mango tree or mango seed or mango fruit. So mango seed become mango seedling. Mango seedling becomes small bush of mango. The bush of mango become tree of mango. Tree of mango become leaves of the mango, flowers of the mango, because I love mango. Amazing. So every mango has a definite shape, like this. Some mango will be kapha big, some mango will be vata skinny mini, some mango will be pitta, they early mature and they become ripe and having pink red color. Even prakriti is there. So Ahankar is at every single cell. Every single cell has Ahankar, and Ahankar in the single cell maintain the metabolic activity, maintain the intelligence. Every single cell in the body knows its food. We just eat all the food, the chapati, the roti, the rice, the idli, the sambar, the masala dosa and pizza, whatever it may be. Our job is to eat, that's all. But boy, in the stomach it undergoes in the digestion, absorption, in the intestine it becomes assimilation. And at every stage of digestion, this food become ahara rasa, the food juice, the microchyle. That microchyle is the food for all different bodily cells. from that food stream, from plasma cell take plasma protein from the food which we ate. Red blood cell take iron, B12, folic acid from that flow of food. Then muscle cell, they choose protein. Fat cells, they accumulate fat from the food, ghee or whatever cheese we ate. It becomes adipose tissue. That adipose tissue just select oily food molecules. Bone cell, they take calcium, magnesium, zinc, copper, iron, all these. So this selectivity is coming from ahankar. Ahankar is a choice. Ahankar means choose, choice. Cellular choice is cellular ahankar. And ahankar is a biological need. Every single cell chooses its food, chooses its nutrients, chooses its nourishing molecule. This is ahankar. Same thing with the animal life, same thing in the plant life. So, ahankar is a universal ahankar which maintains our solar system to operate in a rhythm. Even earth has ahankar. Earth is rotating from west to east and sun is apparently looking that moving from east to west. Who moved the earth? What is the gravitational force? The Veda has discovered long ago about gravity. But Sir Isaac Newton got the credit, which is beautiful. Sir Isaac Newton, one day apple fall on his head and he started thinking, why apple fall? And then he discovered gravity. But in Rig Veda, it is say, Gurutva Akarshan. Guru means heavy. And the Mother Earth is pulling everything to the center. That is gravity. So, this gravity is ahankar of the earth. That's why don't jump from high hill. Because it will pull. It will pull towards her heart. Then it will become part of earth. So, what I want to convey here, ahankar, I'm just giving you the art of thinking. You may not have to accept what I say, but it is so logical. It makes a great significant meaning that ahankar is not ego. It is a biological need. It is a functional organization of the body. And that ahankar split into three gunas, sattva, rajas, tamas. Sattva, the clarity, the purity, the perception. Rajas is movement and tamas is matter, inertia, darkness. Sattva, the perception. Sattva, the pure awareness. Rajas is the flow of awareness, which is called attention. And in attention you attend. And tamas is the object of attention, object of perception. So in our daily life, we are using these three guna. Sattva, the perceiver. Rajas, the movement of perception. Tamas, the thing to be perceived. In other words, sattva, through rajas, go to tamas and meet with the tamas. And meeting point of sattva, raja, tamas is experience. Without the meeting of sattva, raja, tamas, there is no experience. That's why experience gives us pleasure and pain. If you eat candy, that experience of candy gives you pleasure. If you take bitter neem, but neem is good, but it is bitter. And we love sweeter, but bitter is better than sweeter. So that's the interesting thing, that every taste has feeling, every taste has emotion. So Sattva, Raja, Tamas, these are the three universal qualities. They are present in our body-mind machine, body-mind organization, body, mind and spirit, body, mind and consciousness. So you will see that our life is a blending of Sattva, Raja, Tamas, body, mind and consciousness, observer, observation and the thing to be observed. This trinity is the life. Out of this trinity, there is one more trinity which is called Vata, the principle of movement, Pitta, the energy of transformation, and Kapha, the building block material and life. So Vata, Pitta, Kapha, these are the three organizations of our life, body, mind and consciousness. They are all well organized together by these three doshas. Then there are 7 dhatus. So it's very interesting. These are 7 dhatu, building block material. Rasa, the plasma, the serum. Rakta, the hemopoietic tissue, blood. Mamsa, the muscle tissue, skeletal muscle, smooth muscle, striated muscle, hamstring muscle, all the muscle. Meda, meda is adipose tissue, fat. Adiposity is meda. Asthi, the osseous tissue, the bones, the cartilage. Majja, the bone marrow, including nerve tissue. And Shukra Artava, Shukra is male reproductive tissue and Artava is female reproductive tissue. So these are 7 dhatus in the human body. And 3 dosha, Kapha in the chest, Pitta in the intestine, and Vata mainly in the colon. So 3 doshaha, sapta dhatavaha. Dosha dhatu malamulam hi shariram. Sharira means physical body. Dosha dhatu malamulam hi shariram. 3 doshas. Vata dosha is the energy of movement. Sensory stimuli, motor responses. All movement, voluntary, involuntary movement. Movement of the gastrointestinal tract, which is movement. Fine movement in the fallopian tube, uterine musculature, movement. Fine movement during menstruation, the dilation of cervix and contraction of uterine wall, that create menstrual flow, that is also movement. The Vata dosha is responsible for menstruation. Urge to drink water, urge to eat food, all urges are created by Vata dosha. So this is very interesting. Vata is a principle of movement. Pitta, digestion, absorption, assimilation and transformation of food into microchyle, maintaining nutrition and metabolic activity. All that is Pitta. And Kapha is a building block material. Kapha does repair. Kapha creates granulation tissue. Kapha helps to heal the ulcer. Kapha is anti-inflammatory. But Pitta is very strong inflammatory. Flammable. It is flammable, therefore it creates inflammation. Don't say it is inflammable. It is highly flammable, but it creates inflammation. I like English language. Wonderful. Beautiful language. So, when you observe all these constituents of constitution, dosha dhatu malamulam he shariram, 3 doshas, 7 dhatus, and 3 malas. 3 malas are 3 waste: urine, feces, and sweat. Urine is called mutra. Feces is called purisha. And sweat is swed. Oh my God. Hey, come on. Swed is sweat. Many English words, they have their root in Sanskrit. Swed becomes sweat. So, Mutra, Purisha and Swed, these are 3 mala. And mala means impurity. Mana means elimination. We eliminate urine, excess nitrogenous waste in the form of urine. Remaining we can eliminate through the sweat. Liquid waste through the sweat. And solid waste through the feces. It is called Purisha. But don't call Purisha as Purusha. See, different. Purusha is higher consciousness. That's why in Sanskrit, if you slightly change the pronunciation, it will change the entire meaning. Then Purusha will become Purisha. So Purusha and Purisha, very subtle. So this way, these 3 malas, 7 dhatus and 3 doshas, they are the main ingredient of every prakriti, constituents of constitution. So, in this dialogue, we are trying to understand just little basic foundation. This is just introduction to my today's talk. Ayurveda is a clinical medical science. It is more than a medical science. It is a metaphysical, spiritual art of healing the body, the mind and consciousness. So, in Ashtavidha Pariksha, Nadi, the pulse examination, Mutram, the urine examination, Malam, examination of feces, Jihva, the examination of tongue, Shabda, the examination of speech or voice, Sparsha, the examination of tactile sensation of touch, pain, temperature. Nadi, Mutram, Malam, Jivma, Shabda, Sparsha, Driga. Driga means eyes. And Akruti. Akruti means appearance, the look. How person look or the form. So these are called Ashtasthana Pariksha. Nadi Mutram Malam Jivma Shabda Sparsham Drugakruti. So today we will learn some part of Nadi, because Nadi is a very vast subject. Every year at Albuquerque we have summer intensive program. 8 days students are learning Nadi. They come from England, Germany, Canada, even Russia they come. I mean, amazing. Ayurveda is bringing all culture together. Ayurveda is bringing all nationalities together, because everybody feels the deep connection of Ayurveda and their daily life. So, I got invitation from Russia on Moscow University. But this year in Pune, my hometown, there are a group of 30 Russian doctors. They came to Pune to learn Nadi Pariksha. Amazing. They are like you, so devoted, so dedicated. So let us put aside nationality and be a simple, loving human being. That's the beauty. Nationality is one of the disease. It divided the people. We all are human beings. We have human consciousness. We have human nature. And we love Ayurveda. Because whenever there is life, there is Ayurveda. So there is a life in the tree. So there is Ayurveda for tree, Vriksha Ayurveda. There is Ayurveda in the cats and dog. So there is Ayurveda for cats and dog, Shwana Ayurveda. There is a life in the elephant. So there is Ayurveda for elephant called Hastya Ayurveda. Vriksha Ayurveda, Hastya Ayurveda. And previously they used to use horse. And horse has a life. There were no scooter and motor at that time. At the time of Vedas, they used to travel on the horses called Turaga, means fastest moving. Of course, it is the fastest moving. That's why the power of the car is measured in horsepower. Horse is a symbol of virilization. Horse is a symbol of speed. And therefore there is special Ayurveda for horses called Ashwa Ayurveda. So let us first learn human Ayurveda, Ayurveda for human being, and then slowly we will apply to the cat and dog and the tree and the horse and elephant. If you have an elephant, that's good. So, in clinical evaluation, darshan is observation. Sparshana is palpation. Which is a tactile sensation of touch, pain, temperature. Tactile perception. Then under that, akotana. Akotana is percussion. Shravana is auscultation. So this is first darshana. Sparshana. Sparshana has palpation, akotan, shravana. Listening with the stethoscope. During that time, they use little bamboo tube. It is not fair to put your ear on the chest of the patient to listen. It doesn't look hygienically good. Right? The patient is breathing and you are putting your ear to listen to the pulmonary heart sound or cardiac sound. So they use, Shushruti use a bamboo tube to listen. And Shravana, which is comes under Sparshana. And then Prashna. Prashna is questioning. Asking question, inquiring, taking past history, family history, history of previous illness. All these are darshanam, sparshanam, prashnam, etat trividam rugna parikshanam. Rugna means patient, parikshana means examination. Examination of patient is done by darshan, sparshan, prashna. Darshan is very important. So, before we go to the darshan, I like to share with you these three dosha, vata, pitta, kapha. They are not only romantic, poetic idea. It is a reality, it is a substance, it is an actual thing. So, vata dosha is dry, light, cold, mobile, clear. So, dry, light, cold, mobile, clear, subtle, rough, and astringent. Ruksha lagu shita khara sukshma chala vishada. Sukshma is subtle, chala is mobile. So these qualities we have to perceive. In perception, which is darshan, we are trying to observe whether some of these qualities of vata dosha are seen on the body, seen on the surface of the face, seen on the surface of the skin. If you see somebody's skin is extremely dry, rough, scaly skin, oh, it is vata dosha. If the skin is light and thin, papery thin, oh, it is a vata skin. If skin is very cold, oh, it is a vata skin. Skin is mobile, mobile in the sense getting twitching, getting goosebumps or goose pimple. What do you like, goose pimple or bump? Bump is bigger, pimple is subtle. Quivering movement, muscle twitching, that is subtle quality. Clear quality. Vata people, they do not have any smell to the skin. They don't need any perfume. Vata person hardly get bad smell to the skin because it is clear. But Pitta people, they sweat and their sweat contains sulfur. Pitta people have typical odor to the skin. Under the armpit, underwear, they have stinky smell. And that's why they want to hide the truth. They need perfume. Extra imported perfume to hide the truth of Pitta. Right? That is ama. Ama make the dosha to stink. So clear, subtle goosebumps, subtle quivering, subtle tremors can be seen. Then rough quality can create wrinkle. Rough quality can create hemorrhoids, fissures. Rough quality can create fistula. So this is wonderful just to observe this quality. Now Pitta. Pitta is hot, sharp, penetrating, oily, liquid, sour, pungent. Pitta is pungent, light, and it has a strong fleshy smell. Pitta smells like a dead fish. That's a typical description. Pittam sasneha tikshnoshnam lagu visram saram dravam. Saram means spreading, flaring like a fire, spreading. So in Darshana Pariksha first, how we observe these qualities on the body surface. Hot. Suddenly, Pitta person, when the skin is hot, it looks hot flush. Hot, fleshy skin. Pitta. Pitta is sharp. Therefore, there are sharp pimples. Sharp quality can create petricial hemorrhage, bruise. Because of sharp quality, capillary rupture, and under the skin there is a bruise. And when person bruise, big beautiful bruise, large lovely pitta, you can see that. Penetrating sharp quality, penetrating quality. Pitta skin is oily, shiny, oily. If there is so much heat, so much sharp quality and oily, poor hair lose their grip, they just jump out. Therefore, in the full bloom of youth, Pitta person get shiny bald. Like a speaker, He lost his all hair, thanks, it is just donation to the Pitta. Yes, it is a fact. Pitta people are bright, brilliant, but they lose hair. And losing hair is a sign of wisdom. Okay. And prematurely grey hair, premature maturity. Premature maturity is Pitta. So that's we can observe. Pitta is oily. Liquid quality of Pitta make the skin sweaty. When sweat is there, so skin looks oily, sweaty, Pitta. Because Pitta is sour, Pitta people's skin will have acidic pH. Therefore, their skin is extremely sensitive. These people can get allergic dermatitis, eczema, psoriasis. Pungent quality will create inflammation. And light quality both belong to Vata. Vata is light, opposite of heavy. Pitta is light, opposite of darkness. So there is so much light in the Pitta, therefore Pitta person's skin is very sensitive to the sunlight. If a Pitta person lie under sun, he will get sunburn. Because light quality of Pitta make the skin to be sensitive to the sunlight. Fleshy smell, because of sweat, it will create fleshy smell. And Pitta is spreading like hives, rash, urticaria, eczema, psoriasis, spread all over the body. That spreading quality of Pitta can be observed as a rash. So this way you can observe the Pitta quality on the skin. Then Kapha. Kapha is heavy, dull, slow, cool, damp, oily, slimy, then thick, dense, and cloudy, and pale. These are the quality of Kapha dosha. So you will see that heavy quality make the person's skin look heavy, thick. If you want to take a pinch, you have to take a big pinch. You cannot catch that skin within a small skinny mini pinch. You have to take a big pinch. Then you can hold the skin because skin is thick. With a vernier caliper, you can measure the thickness of the skin. Kapha person's skin is thick, but kapha is pale. Therefore, kapha skin looks pale. Then looks dull. Skin looks dull means it loses prabha. Prabha means intelligent. When your skin is intelligent, you look handsome, you look beautiful, you look glorious. That glory comes from Tejas principle. But when kapha is a cloudy, it clouds the light, therefore it becomes shadow. That is called chaya. Varnam akramati chaya, prabha varnam prakashati. Prabha varnam prakashati. Tejas principle give beautiful glow to the skin. But when Tejas is suppressed by cloudy kapha, skin looks dull. So that's very interesting. Then kapha person's skin is cold, clammy, damp, cold, oily, slimy. Shlakshna means smooth, slimy, thick, dense, and plenty hair. Hair everywhere. And finally, there is a kapha skin looks rather cloudy and pale. So I'm just sharing with you the art of perception. How we can perceive these qualities in darshana pariksha of the skin. Darshanam is perception, observation. Darshana is observationa. Observationa, darshana. Just little Sanskrit. I'm not scaring you by talking Sanskrit, but it is cute language, very old language. And if you learn Sanskrit, you will become great musician, great singer. And Sanskrit chant will take you to the different dimension of life. So, Vata Pitta Kapha, with this qualitative expression, in Darshana Pariksha, we are observing clinically some of this quality in order to determine which dosha is behind it. Correct? Now, so we will start our observation. Examination of the face. Examination of face. Face is the mirror of mind. And face is a very fascinating thing. Just by looking, you understand what problem is there. So take a new page and just draw, just imitate the teacher, okay? Draw a face, human face. All my students become good artists. Excellent. Let us give some hair to him. Now he looks Mr. Smart. Huh? So if you look at the face, round face is kapha. Tapering face, like a heart shape, is pitta. And long face with dented, bented cheeks and nose, football player, it is vata. So the shape of the face can reveal the dosha. So when you look at the face, the size, the shape, the surface, the contour, the forehead. If you have tall forehead, broad, it is called bossing forehead. These people are philosophers. These people are very spiritual because they have bossing frontal lobe. And frontal lobe is a philosophy. Frontal lobe of the brain is a great thinker. So when you have broad, tall forehead, maybe due to receding hairline, but it is there, that person is a very great spiritual thinker. And I will choose some of you from you, and I will show you, just read the person's face. Face reading is very important. Just look at the face, the forehead. Oh, something is there. So this is regarding that. Now, if there are horizontal lines like this, these are called worry lines. Person may not talk about his or her worry, but worry line can be seen. By the way, Ayurvedic Institute send you the handout. Yeah. But don't look at that now. Then you will miss the whole beauty of this dialogue. Your half mind is in the picture, half mind is to the speaker, and you will miss the bus. So, at your leisure time, just read this. Horizontal lines are worry lines, line of anxiety, because there is a tarpaka kapha, sadhaka pitta, and prana vata. When there is the aggravation of prana vata, too much thinking, too much anxiety, and the frontal lobe get little wrinkled, so that the forehead shows that horizontal line. If there is a one line, it is one worry line. Two line, two worry line. Three line, three worry line. Maybe 1.5 worry line. One is a major, second is minor. So we all have certain worries, and that can be studied just by horizontal line on the forehead. Now this is the right side and this is the left side. If there is a one vertical line here to the medial end of the eyebrow, this vertical line is called liver line. When person has lot of unresolved anger, irritation in the liver, liver is a seat of anger. Liver is a seat of pitta, ranjaka pitta. And when your ranjak pitta is hot, liver become hot, and that create vertical line on the medial side of the right eyebrow. That is the liver line. Another line is spleen line. Vertical line is a spleen line. Spleen is a large lymphoid tissue. It is connected to the hemopoietic system. And spleen and liver, they work together functionally because spleen filter the blood from old cells and new cells. And old cells, which is more than 130 days, they are collected and they are sent to the liver. Then liver destroy them. And out of disintegration of old RBC, liver produces hemoglobin, heme and globin. That globin part is ojas. That's why doctor give gamma globulin shot to prevent hepatitis. That globin is rakta ojas, which is very important. And liver and spleen, they have functional integrity. Spleen is a large lymphoid tissue. In embryological life, in intrauterine life, liver and spleen used to produce red blood cell. Erythrogenetic, hemopoietic function was governed by liver and spleen in the intrauterine life. Later that function is transferred to the bone marrow, rakta majja, red bone marrow. And that red bone marrow, which is present in the head of the femur, head of the humerus, then ribs, then iliac crest. These bone marrows within the bone, they do erythrogenetic function. So, spleen and liver, they are the root of Rakta Vahasrotas, hemopoietic system, according to Ayurveda. Rakta Vahanam Srotasam Moolam Yakrut Plihacha. Yakrut is liver, Pliha is spleen. So, whenever spleen is an organ, spleen has important function of defense mechanism. Whenever there is infection, spleen produces and send more leukocyte. They are the phagocyte and they attack to the area of infection. So, whenever person has previous repeated infection, body is functioning, operating under the great stress of infection, exposure to the virus, exposure to the bacteria, then spleen immunity depleted and person gets strong line, spleen line becomes strong. Then at the center, if there is a central line, that central line is a line of skepticism. Skepticism. The frown on the crown. The frown on the crown, central line. These people are very skeptical, judgmental, critical. So whenever you talk to the person with the line at the center, be careful. Don't say any imagination, tell them the reality. Because they are skeptical. They will always go into judgment, criticism, like and dislike because they have frown. Frown means questioning. Skepticism means questioning. Even God come today, they will ask him, prove me that you are God. Otherwise I am not going to accept you. There are some logical people. They have great logical mind, reasoning mind. Please.
Does it happen because people filter everything through the mind and don't listen to their inner, like they cut the feelings?
Correct. Oh, beautiful. This brain is a seat of sadhaka pitta, which is understanding, comprehension, appreciation. Heart is also seat of sadhaka pitta. Heart processes thought, feelings, emotion into love and compassion.
So when here is shut.
So that is totally shut. No love, compassion. They are great military officer. Right, left, about, turn and fire. You cannot think, just do like that. So the heart is closed. So military officer, they are not supposed to be so emotional. Then he cannot fight a war. And most of the military officers, they have big frown on the crown. Okay? Very good question. So, because what we are thinking, it is directly reflected on this forehead skin. Not foreskin, okay? Forehead skin. God, funny word. Forehead skin is directly connected to the frontal lobe. Now, so horizontal line worries, liver line right side, spleen line left side, in between is the central line, the line of skepticism. Then some people develop a little groove here at the root of the nose, especially middle-aged people. They develop a groove. That groove is a sign of prostate in the man and cervix in the woman. If a woman has cervical erosion, cervical dysplasia, cervical tightening, severe dysmenorrhea, they get a groove at the root of the nose. And in the man, benign prostatic hypertrophy, enlarged prostate gland, retention of urine, an increased frequency of urination during night time after the middle age. Think about prostate. So, this is very important. Because if you probe from here, your probe will go to the pituitary gland. And pituitary gland produces luteinizing hormone, follicle stimulating hormone, oxytocin, all those different hormones, they are responsible, luteinizing hormone, follicle stimulating hormone, they stimulate seminiferous tubule and they produce testosterone and they produce sperm in the man. Same luteinizing hormone, they stimulate fallopian tube, Graafian follicle, and they regulate ovulation. So, these hormones, when they are depleted, it will create, at the same site, it will create groove at the root of the nose. So, you should understand this has a great significant meaning. Whatever is going inside, it reflects outside. So this is very important sign on physical level whenever you are reading someone's face. If this supraorbital line is cut here, that supraorbital line which is cut over the eyes, cut line of eyelid, it is connected to the ovary. Ectopic pregnancy, ovaries, ectopic gestation, tubal pregnancy. I just diagnosed that without feeling pulse, just look at her. And I said, oh, you have tubal pregnancy. If it happened to the right side, it will happen to the right eye. If happened to the left side, it will happen to the left eye. And there was a beautiful student from London. She came to Albuquerque to study. And I saw that line. I said, oh boy. And I say, likely you have ectopic gestation. And you will surprise, at midnight she had severe pain. She has to be admitted in the hospital. They have to do surgery, remove that ectopic gestation. It is wonderful to observe that. So, a cut line of eyelid, it is ectopic, tubal pregnancy.
So, I'm not sure what you mean by the cut line. I don't know what that might look like.
Can you stand here, dear? And come here. Just close your eyes now. Open. Can you see this? She has complete. She doesn't have any ectopic gestation. Excellent. See? If this line is broken here or here,
Is
that is
a vertical line?
correct. Thank you, dear. Very kind. Wonderful journey together about examination of face, human face. And we talk a little bit about horizontal line on the forehead, vertical line at the medial end of the eyebrow, the central line, and the root of the nose, the groove. Then when upper eyelid is bulged, that is a sign of fatty liver. Fatty liver. When a person has fatty degenerative changes in the liver, they get upper eyelid bulging. And they always have high cholesterol. That is one. Or person may be having history of alcoholism. When bulging of the lower eyelid, like this, bulging of the lower eyelid, it is a kidney line. Kidney energy is low. So there is a retention of fluid in the body, and the skin over the lower eyelid is loose. It can show the bulging of the eyelid. That happens in a long journey when there is no sufficient sleep. Lack of sleep can create this bulging of the lower eyelid, puffiness of the eyelid. Early morning, when person wakes up with puffiness of the face, think about acute glomerulonephritis, because the kidney is the organ of water. It drains excess water out of the system. And when there is accumulation of interstitial fluid, water retention, then bulging can be seen clear. Now in the nose, here, a groove, very strong groove at the nose, nasal area, nostril. This groove on the nostril is a low lung energy. It may be respiratory allergy, asthma, emphysema. Emphysema means air hunger. There is a diminished air entry, and the patient breathes with flare nostril. When nostrils are flared, expanded, and there is a deep groove here, it's a sign of pulmonary insufficiency, asthma, emphysema, respiratory allergy. Then the groove on the nose here. When there is a groove on the tip of the nose, It's a sign of hemorrhoids. It's a sign of hemorrhoids. Then the blood vessels on the nose are prominent like this. Prominent blood vessels on the nose is maybe hypertension, high BP, or alcoholism. These nasal blood vessels on the nostril and the tip of the nose, they look prominent and you can see them. Along the same line, blood vessels look prominent in the eyes. That prominent blood vessels in the eyes is also a sign of alcoholism, or high blood pressure. Along those lines, there is a prominent blood vessels here on the temporal area, that is also high blood pressure and history of stroke, paralysis in the family. When the temporal blood vessels are prominent, these people should not do headstand. Headstand can increase pitta, shirshasana. So when blood vessels on the temporal area are very prominent, then you can think about high blood pressure or family history of stroke, paralysis. Receding hairline. Soon he will look very horrible. Receding hairline. This receding hairline is a sign of high pitta, pitta prakruti, pitta vikruti, and it is a sign of hypothyroidism. Hypothyroidism. In some patients, the outer 1/3 of the eyebrows are lost. Outer 1/3 of the eyebrows are lost. That is also a sign of slow metabolism or hypothyroidism. Then nasolabial line is prominent here and here. Nasolabial line is prominent. That is a line of malabsorption. Nasolabial line, a line from the nostril to the angle of the mouth become prominent. That's a sign of chronic malabsorption. Entire puffy face, a moon face, puffy face, is a sign of steroidal toxicity. Corticosteroids are given in the patient of asthma, in the patient of eczema, psoriasis, or allergy. Whenever a patient has taken steroidal therapy, it does show steroidal toxicity on the face. Then lot of hair in the ear. The hair come out. Oh my God. I know some people, their hairs are coming out. So multiple hair coming out of the ear, that is also connected to the cholesterol. High cholesterol, or family history of stroke or heart attack. Family history of heart attack or stroke.
that apply to women as well? I haven't seen a woman with hairy ears.
Oh yeah. It can be applied to the women also. If a woman gets facial hair at the age of 25, facial hair, mustache, think about polycystic ovarian syndrome. Polycystic ovarian syndrome. So facial hair in the girl or in the woman at the age of 25 is polycystic ovarian disorder, PCOD, polycystic ovarian disorder, because of hirsutism, due to hirsutism. Sorry, I'm moving too much, you have to move the camera. Sorry. These are very important clinical cardinal signs of those disorders which we have to learn.
Dr. Lab, excuse me, how do you see nasolabial line on a person like me who has a beard? How do you see it?
What?
The nasolabial line.
Nasolabial line.
Nasolabial line. How do you see it on someone who has a
No,
hair on the face?
if you have mustache and beard, then many signs are hidden. You look handsome, beautiful. So that's like you look very handsome and very energetic. So good, enjoy that.
Not on me, I mean on other persons. So it's hidden.
Then we have other signs to observe. For example, the groove as well as grieving groove, grief. You may get another groove here. That is a grieving groove, so person has unresolved grief, like here. Grief line. Or you will get grief line here also. Grief line. Line of grief. The grieving groove is also the sign of low libido. And when there is a dimple here at the chin, it looks very good, but it is not good because it is a weakness of the prostate. Prostate problem. Person can get prostatitis or benign prostatic hypertrophy.
What if the woman has a dimple?
Cervical erosion. Cervicitis. Double chin. When chin is baggy, double chin. Double chin is a sign of hypothyroidism, slow metabolism, and diabetes. Diabetes is a disorder of slow carbohydrate metabolism. Even they eat rice, become sugar. So this way, we are looking at all these different signs, the characteristics on the face. Yeah.
Vasant, what about these lines that come out from here, the sides of the eyes, those long lines that are not just the smiling lines?
Means line from here.
Yeah.
Oh, that is solar line. They are working under hot sun. Yeah, that is as simple as that. When you are working under hot sun, you just try to reduce the exposure to the sunlight. You do like this, and that create a line. So that is working in the field. Especially farmers have that line.
Can those lines also disappear again, or?
If you do facial work and if you do Shirodhara and facelifting, it will disappear. There is Ayurvedic facelifting. I'm going to share with you. Then redness in the cheeks. Oh my God, what is happening here? Red cheek, malar flush. Red cheeks, malar flush is a sign of heart disease like congenital mitral stenosis. Congenital mitral stenosis, rosacea, or allergy. So it indicates heart condition, allergy, rosacea, heart condition, mitral stenosis, or it could be alcoholism. A fair person drinking alcohol every day in the evening, whiskey on the rock, the next day wake up with a red flushed face. That is rosy cheeks. And they think that they look handsome. No, it is not handsome. It is damaging liver.
So this also maybe connected to the liver when people get pock marks in the skin.
Correct.
So all the
Pock marks or aging marks.
big nose, it's all the same?
The brown spots like this is a sign of low adrenal. Low adrenal. Chronic fatigue.
Is that only just on the face?
The brown spot on the cheeks.
Okay, but what about on other parts of the body?
Anywhere. Brown spot is a sign of hypoadrenalism. They have postural hypotension and they feel dizzy when they suddenly rise up from the chair. Their blood pressure drop down, they feel dizzy. So all that is connected to the adrenal dysfunction, adrenal fatigue. Now here, when the ear has crease on the ear lobule, that is also sign of high cholesterol. And gouty trophy, it is a chalk, like a calcium, and over the helix of ear, top ear, you can get that. Means it is high uric acid. And high uric acid can create attacks of gout. And in the eye, this is conjunctiva, encroachment of conjunctiva on cornea here. This is a kapha disorder, pterygium. If it comes to the pupil, it can create blindness. And suddenly there is a bloodshot eyes here. That is called episcleritis. That is earlier sign of rheumatism. autoimmune disease. If the sclera is dirty and muddy, ask the person to look down in this portion. If it is a dirty, muddy sclera, diabetes. And if sclera is blue, very clean blue, that's not a good sign. It is a sign of osteoporosis. Osteoporosis. And along the same line with the lips. If there is a line at the center of the lower lips, that is a sign of diverticulosis. Lower lips connected to the colon. And if there are different brownish patches, it's a sign of Krumi parasite. And blue lips is a sign of congestive heart failure, CCF, congestive cardiac failure. So, I just shared with you the theory behind it. Now just turn your face to your friend sitting next to you, draw the picture of your friend, and try to find out which anomalies you can observe. Okay? And I'm just sharing with them how to do the reading of the facial line. Sandra's face is oval. It is not round. Round face belongs to Kapha. Oval, long, so it is Vata and Pitta. If it is tapering, then it is 100% Pitta. But it is a combination of Pitta and Kapha. She has very tall, prominent, bossing forehead. That means she is a deep thinker. She is a great philosopher. She is very spiritual, very loving, very compassionate. But when I see there is 2.5 worry line, 2 major worry, then 1 is half worry. So that's very interesting. Okay, thank you, dear. The eyes are sunken. Sunken eyes is also chronic malabsorption. Very sunken eyes is a consumptive disease like tuberculosis. You don't have that, but I'm just sharing with you. Chronic consumption, chronic malabsorption can lead to the sunken eyes. Her eyes are sunken. Her nose is pretty sharp, straight, but there is a little groove here, so there may be small internal hemorrhoids. You never know, but they are there, silent internal hemorrhoids. Then there is a nasolabial line is prominent. That indicates there is malabsorption. Do you grind your teeth in a deep sleep?
I don't know that.
Yeah, how do you know? Nobody knows.
Didn't hear it.
But do you get some tension in the temple area, some temporal headache? Many times people who grind the teeth in a deep sleep out of emotion, they build tension in the temporalis muscle. that can lead to the TMJ, temporomandibular joint syndrome. They do not know that they are doing that. Now can I read your pulse? Thank you. Excellent. Yeah, her reading goes together with the pulse. Her pulse is Pitta predominant, Vata secondary. So Vata 2, Pitta 3, Kapha 1, Pitta predominant. That's why her facial expressions are dual doshic expression, Vata Pitta. Then lips are dry because there is not enough water intake. So you have to increase. How much water you drink?
I think 2 liters a day.
2 liters a day. That's good. But still lips look dry. So that is a sign of subtle cellular dehydration. There is one little small grieving gru is there. Is there a family history of hypertension?
I don't know.
You don't know?
No, I don't know
No,
any.
okay. Any hyperacidity, acid indigestion? Okay.
Very Pitta mother.
Maybe.
Can I see the tongue? Excellent. There is a line, so that shows tightness along the spine, tightness along the neck and shoulder blade area. So this way we can do reading of the face. Thank you, dear.
Thank you, Dr. Ladd.
Willingly, who would like to come here? I should just close my eyes. Yeah, you want to come? That's great. And where is your partner? You are the partner? Come, dear. What you share is very good. That we both are going to observe the face of your friend. Is there another chair here? No. Wow, you are a good artist. Amazing. See how beautiful pictures she has drawn. Excellent artist. So your name?
Margarita.
Margarita. And your name?
Antonella. Antonella.
Antonella. Thank you, dear. So now, what do you read on her face?
So the spleen line.
Spleen line is
Prominent.
eminent and prominent. Correct. What else?
Then a bit of malabsorption maybe.
Correct. And there is a deep groove in the nostrils, so there is some weak energy in the lungs. You had any cold, congestion, cough repeatedly, or respiratory allergy or asthma type symptom? Nothing. Any common cold? Nothing. Okay.
Comes and goes if there is.
So there is a deep groove. It indicates her lung capacity is not at par.
A bit of puffiness around there. Like this area.
Uh-huh. So what does it indicate?
Some sort of congestion.
Congestion, okay. Can you swallow?
Yeah, no, it's also a bit enlarged maybe.
Yeah. When she swallows, can you see the impulse?
Yeah.
Just swallow. Sorry. Yeah. Now, just stand up here 1 minute. And when I ask her to swallow, I feel the impulse. Now I am confirming it by putting my hands over. Just swallow. Yeah. There is a thick lump is moving up and down. So there is her right lobe of the thyroid has hyperplasia, increased number of cells, because your diet is missing iodine. You need to take iodine. Then, do you easily put on weight?
Pretty much so.
Yeah, pretty much. So that is a sign of hypothyroidism. Yeah, is there family history of diabetes? Right, see? Diabetes and hypothyroidism, they go together. Diabetes, hypothyroidism and slow metabolism go together. This hypoactive thyroid gland can lead to slow mentation, it can lead to depression. So for no reason she might be feeling a sad feeling of depression. That happens? Yeah, that's great. Did you fall on your nose?
Against the lamppost when I was young.
See? Long ago she fell on the nose. So her nasal bridge is twisted here. You were playing some jumping or?
Something like that, yeah.
Uh-huh, yeah.
I was looking where I wasn't going and I whacked myself straight into it.
Okay, that's great. What else you have observed?
And the groove, yeah.
Yeah, there is a groove. There is a grieving groove. And this groove here is cervical changes. In case of man, it is prostatic changes, and in case of woman, cervical changes. So sometimes it can create cervicitis, cervical erosion, or painful menstruation. Okay? Thank you, dear.
Thank you.
And did you observe her face? So could we replace, you can sit here and you can sit here. This is a great thing to observe what we learn. Yeah. So.
I observed the two lines.
Yeah.
On
First, her
forehead.
forehead is very prominent. She is a very deep thinker, great philosopher, and very spiritual person. She is very compassionate too. Then this prominent ridge, temporal ridge, is there family history of hypertension? Yeah, and stroke paralysis.
Yeah.
So she should be careful about her blood pressure. Okay. Anything else?
I was looking at this as well.
What happened this?
Just today, woke up, congested.
Yeah, but it is quite inflamed and swollen.
Yeah, don't know.
Some mosquito bite there?
No,
No?
nothing. Just today, woke up like that.
You woke up and you saw that.
Yeah, sometimes it happens from time to time, but rarely. Not often.
Okay, so it looks like some insect sting, yeah. So you can apply turmeric and sandalwood cream. That will take care of that. So this is local agantu, external cause. Okay.
It can also be eyelids, just going over the eye, double eyelids, cutting line of the eyeline.
Ah, very good observation. So what do you mean by that?
Reading from here, basically.
Yeah?
Reading from here. Connected to the ovaries.
Connected
Yeah.
to the ovaries, right? So maybe there are some cystic changes in the ovary. Do you get pain during ovulation? In the right ovary, left ovary?
I don't ovulate. No.
You don't ovulate now. Yeah, it is gone. Thank you.
But I do have a bit of discomfort.
Discomfort.
Maybe because of
Yeah.
menopause.
And there is also groove here at the tip of the nose. It's a sign of hemorrhoids.
You did say it.
Yeah, there is. Right.
Okay. And the malabsorption.
Correct, malabsorption line. Excellent. Can you swallow? Oh, yeah. The thyroid looks normal, but I will confirm. Can you stand here? You know, there is another, when we go to the pulse, we will learn about that. Swallow again. Yeah, her both thyroids are normal. There is no bulging. Then I am putting my 3 fingers over the carotid artery. Index finger vata spike, middle finger pitta, ring finger kapha. I get strong spike under middle finger, so her thyroid is strong. Whatever she eat, it turns into ash. Okay. So she has strong metabolism. That's why you cannot put on weight. That's a good sign. You can easily lose weight. You can easily put on weight. Okay, can I see your tongue? Yeah, tongue is clean, like a rose petal. So she had pretty good Agni, and there is no arm. Thank you. Thank you. Any other? You come here with your partner. It's so good that A is watching B, B is watching A, and this is a great learning. Hello. Your name? Davarka. And your?
Susan.
Susan. Good. Oh, I like your face. This is a Halloween pumpkin face. That's good. Yeah. So, your name you said?
Susan.
Susan. So, Susan, can you read her facial expression?
Okay, so we have a little, so also very high forehead,
Yeah, high
as you
forehead. She's
mentioned.
very
So
philosophical.
big thinker, yeah. And the outer edges of the brow are starting to fade.
Thinning, yeah. So that is connected to the thyroid. Excellent, good.
And then again we see some thyroid
Yeah,
developing
little
here.
bulging.
So, yeah,
Bulging
so
of the
something
chin.
to pay attention
That's
to.
great, really beautiful.
And then no adrenal function from underneath the eyes.
Correct, there is a brownish spot.
Yeah, the spots, but also even the little color gray.
Color is gray, yeah.
Maybe some kidney
Mm-hmm.
problems with the puffy under the eyes.
Mm-hmm.
Very mild, I think. Low malabsorption, not very strong.
Correct, there is a nasolabial line.
Yeah, but not
There is
too
a
strong.
malabsorption. Can you turn this way? Yeah, okay, thank you.
Interestingly, the fossa is sunken, but
Correct, right.
but she says that also she was breastfed. So why else would that be?
You mean this?
Mm-hmm.
This is called suprasternal notch. These are right and left sternocleidomastoid. So it is normal.
So this is not the problem of the fossa
No,
being
no, no,
sunken.
no,
Okay,
no.
okay.
Can you swallow? Mm-hmm.
Seems a little heavier on the right than on the left. So
Correct,
a little
correct, yeah.
puffy on the right.
Her neck is little tilted,
Mm.
twisted, tilted. Because her right sternocleidomastoid and left sternocleidomastoid is sunken, right side is prominent. You had any pleurisy with effusion, any pleuritis in the past? No. Okay. Sometimes when one sternocleidomastoid is prominent, means mediastinum is shifted to that side. So it can happen in pleurisy or fibrotic changes in the lung or shifting of the mediastinum to the opposite side. So that then we can confirm that. Can you stand here and face that? Then grab her back and ask her to breathe. Breathe out. So it is a bilateral inhale, exhale. Good. It is a bilateral. Now keep the hand. Inhale. Okay, so I was grabbing her back posterior chest wall with my hand, and I was asking them to breathe in, and both hands expand. Both hands come. If one hand moves and other doesn't, that sluggish hand indicates sluggish entry. So she had equal bilateral symmetrical movement. So there is no pleurisy, no mediastinal shift. Maybe you had any neck problem in the arthritis, cervical, spondylosis, nothing?
No.
You had any car accident, any whiplash?
No.
No.
Could it be functional? Because I think you work with computers.
Yeah, I
so
work
maybe
a lot.
Yeah.
it's a
So she
functional-
has computeritis. She is stuck with computers. How many hours you are stuck with computer?
Around 8 per day.
Wow. So like this. And at the same time taking phone. So phone is here and you are working on it. So this is currently functional or postural. So you have to correct your posture. Bring awareness to your posture, how you walk. Stand in front of the mirror and say, just look at yourself. That way you can do some yoga stretching and that will help. So this deviation is functional.
Okay. That was mostly it, I think.
Correct. Since astis are strong bone, as a young girl she used to love gallons of milk, but not now.
Yeah.
No. As a young girl she drank a lot of milk. Can I see your tongue? Yeah, her tongue is very strong and there is a tightness along the interscapular area. There is a groove on the tongue. Okay? Thank you. Now we will exchange. Thank you. Now, dear friend, so tell me your observation.
She has quite a long face, oval, so to me it comes across as most Vata type of a...
Correct.
And then her eyelids look normal, so I would not say that there is something going on. Her eyes are, I would say that kidneys probably need a bit more energy. And
you do too much gardening.
I think I probably should do more gardening and less
So
of
you do
other
some
things.
gardening. So these are gardening lines.
I'm outside a lot.
See, this is outside line. So these are outside lines. Gardening line, outside solar line.
Yeah. Yes. And I see that probably she has a bit of malabsorption as well.
Correct.
And for the rest, a bit of spots on the skin as well. So either high pitta are coming through, or because she's a lot outside, it could be also that her skin is just
She is very hard working. And she had a little groove here, so there is a grief, unresolved, deep-seated grief.
Yeah, and I saw
she is very compassionate, huh?
And I also saw a small line here vertically.
Over the upper lips.
When you're not smiling, if you just relax your face, then there is a small lines you see here and here. So I'm curious about what this could be.
Those lines, so forgive me, they are related to the aging.
Okay.
But you look young, okay?
It's okay. I can take it.
Sorry, I don't mean that you look old aged. But see this here, these lines, prominent. Also, it is sign of low libido, but I was embarrassed to talk about that. Therefore, I shift my attention to the aging, okay? It is not polite to say, hey, you have low libido. It's weird.
And when she was looking down with her eyes, and you know the sclera.
Can you look down?
Yeah. And you could see.
Oh my God, can you look down? Yeah, there is slight yellowish tinge. So that means she had toxins in the liver and there is a yellowish tinge. And sclera part looks little bluish.
Yeah.
So there is a osteopenia, osteoporosis or degenerative changes in the bone. You don't drink milk.
I take dairy products.
Dairy products.
I have some milk.
You need some calcium, right?
Maybe I'm not absorbing the calcium.
Correct.
But could it also be with regards to an accident, or is that something?
You had accident?
Yeah.
Oh.
Yeah.
Car accident?
It was a bad fall in the mountains.
So
wow.
then I broke my pelvis
Pelvis
in the,
bone, okay.
in the bone in the
Could be connected to the accident,
Mm.
right?
Mm.
Good observation.
Mhm.
Anything else?
We had a question about the difference, do you remember?
Yeah, we were observing the left and the right side, and if they're not quite in the eyes.
Correct, correct. Yeah, right eye is bigger than the left eye. Right?
Yes.
Yeah. Such a keen observation you have. Amazing. So, unilateral changes in the eye. One eye is small, one eye is big. Her right eye is bigger than the left eye. Means her male energy is overpowering to her female energy.
Yeah, that sounds about right.
Yeah. So your male energy is more dominant than the female energy. That's why left eye is female, right eye is male.
So what do I have to do?
Do alternate nostril pranayama.
Just no, okay.
Yeah.
Okay.
That's good. Thank you.
Thank you. Thank you.
Who else? The last pair. Come on. Oh, this is very beautiful. Have a seat here. I like this way of learning. Excellent. Your name?
Katrina.
Katrina. Katrina. Oh, and your?
Eva.
Eva. Thank you, Katrina and Eva. So, Eva, what do you see?
So I've noticed that Katrina has lovely and prominent forehead. So that's forehead of the thinker.
Mm-hmm.
In terms of her line, I just noticed grief lines.
Correct, grief lines are there.
There is, and not much.
There is
Except-
a malabsorption line.
Oh, here, oh yes.
Mm.
See, I was comparing to mine, which are very big. And as well, I noticed that the thyroid.
Correct.
That there
Can you
is-
swallow? Once more, sorry. Thank you. We should have sip of water. There
Yes.
you go. Yes, she had a prominent Adam's apple. Hmm?
Oh, here, there's like a gold on the right side.
Yeah. There is a little right thyroid hypertrophy, left thyroid hypertrophy. But do you get tremors to the hand? Not quite. No. Can I check it 1 minute? Yes, start with. Okay. Hurry on. Swallow. Her thyroid function is okay. Only her left lobe is hypertrophied. So she needs iodine in your diet.
Okay.
Seaweed. Or best is Kaishore Guglu. Yeah.
And a little bit of vessels. We have the blood vessels
Correct.
on the side of.
That may be family history of hypertension.
And there's a small line.
And there is a groove at the tip of the nose, small internal hemorrhoids.
Is it here? Oh, that's
Yeah.
this one.
Tip of the nose. Great, huh? You have 2 children?
3.
3 children, right? She is the divine mother of 3 children. Vata, thank you. Thank you. Okay, now we'll change. Sorry. Hariyo.
Yeah, you saw the 2 lines, small, not very deep.
Yeah, liver line and spleen line.
And also many worry lines.
Oh, she sleeps on the bed of worry, bed of thought.
I'm not.
Yes, that she's not a worrying person.
I'm not a
She
worry.
said she doesn't
Okay,
worry.
maybe it is
Yes.
subconscious. We are not conscious of it. Yeah.
You saw the lines for the malabsorption.
Malabsorption, excellent.
Also, solar lines.
Solar line.
Yeah.
Okay.
Also, not too much, but also the vessels.
Yeah.
the blood vessels.
Any
Yes.
respiratory problem? You had bronchitis or any other pulmonary congestion? Nothing. No family history of asthma, eczema.
My daughter, but not.
Your
my
daughter
parents.
has. Okay. So maybe there is an allergic manifestation. That's why this nasal line is prominent. Anything else?
The eyes seems fine. I see puffiness.
Can it look? Can it look down? Yeah, her sclera is blue
bluish,
here.
yeah. And the light there you cannot see it. But here is a lot of light, and now I can see it.
Yeah, it's good to see. Because you have deficiency of vitamin D3 and calcium. So you should take that. Because you are mostly indoor. So indoor people, they cannot get sunlight, and lack of sunlight can cause vitamin D deficiency. That's why your sclera looks blue. Excellent. Any other thing? Can I see your tongue? Yeah, tongue shows tightness in the neck and shoulder blade area. Excellent. Thank you.
Thank you.
Oh, thank you, dear friend. It was a wonderful feedback from the student. They were sincerely observing what we learned during the morning session. So, any question you have? Yeah. Please come here. Please come here. Oh, somebody did trimming or what?
No, I was born with it.
You born with it. But this side it is complete. See, this is like a fetus with the head, neck, lumbosacral area. So do you get stiffness in the back area, lower back?
No, but thanks to Ayurveda, Abhyanga.
Yeah, that's good. You are taking good care. Because this kind of helix is just merged into that. This is the lumbosacral area. So you should be cautious about that. And this can lead to constipation, bloating, low backache, painful menstruation, or lumbago. Thank you.
Thank you.
I wanted to know that the person I observed has little.
Please come both here. Thank you. Okay. So what you were sharing?
Okay, my question was...
Can you stand here so that there is a light on your face?
Okay, I didn't understand the little lumps there on each side of the eye.
You mean this?
Yes, the one is bigger than the other.
Correct. She had fatty changes in the liver.
Okay.
That's why it is a bulging.
Okay. What changes? The liver.
There are fatty degenerative changes in the liver.
Okay.
That's why her cholesterol is fluctuating.
Okay.
Going
up and down. Thank
you.
I didn't
Thank
understand.
you.
Thank you. Thank you.
So, yeah.
Just wanted to ask the whole session today about the observation. If there is any overlapping from the Chinese, or is it only Ayurveda, and what is the reference?
These are developed through both Ayurveda, and I was working in the hospital. It was clinical medical hospital, and for the last 30-40 years I have collected the data, and out of that data, this is the integral knowledge coming from practical clinical approach. When fatty liver is there, I saw that there is some connection. When there are krumi, parasite, and I look at the tongue, there is a depapillation. So, by observing clinically and by observing physically, this database is there. I think it is Ayurveda, but modified Ayurveda, based upon integral approach, clinical approach to Ayurveda. Because Charak says, Ekam Shastram Vidhyano na Vidyat Shastra Nishya. If you know one system, one technique, one method, then you cannot enhance the horizon of your wisdom. Tasmat bahusrutaha shat chikitsaka. Therefore, chikitsak means physician should be bahusrut. He should study modern medicine. He should study Chinese medicine. I spent my whole life in studying. Look, I lost 30 billion hair. I just spent my life in learning. Now I got that wisdom. So, but it is pakka, Pakka means perfect. So,
about the creamy.
Ah.
Yeah, so it's
Creamy can be seen on the lips like a white spot or on the tongue like a deep appellation.
So it's not the color change also.
No. Thank you, doctor. Yeah. So wonderfully, it was a wonderful session. I had a great joy to share with you the ancient Ayurvedic wisdom with modern parameter. Namaste. Sahana bhavatu Sahana bhunatu Sahaviram karavahai Tejasvina adhitamastu Ma vidvishavahai Shanti, Shanti, Shanti. Yontah pravisha mama vachanimam prasuttam sanjeevayatya kila shakti dhara swadhamna Anyam cha hasta charana sravanatvadadim pranam namo bhagavate purushaya tuvyam rajojuse janmani sattva vrittaye sthitam prajanam pralaye tamasprishe ajaya sarga sthiti nashe hetave त्रयीमयाय त्रिगुणात्मनि नमः संगच्छध्वं संवदध्वं सम्मो भचांसि जानतां देवाभागं यथा पूर्वे सञ्जानाना उपासते अखण्डमण्डलाकारं व्याप्तं येन चराचरम् तत्पदं दर्शितं येन तस्मै श्री गुरवे नमः तस्मै श्री गुरवे नमः तस्मै श्री गुरवे नमः गुरवे नमः गुरवे नमः Reading pulse is quite an art. Plus it is also a science. Almost in every medical system there is a pulse reading. Chinese pulse is famous. Even in modern medicine, they read the pulse with rate, rhythm, volume, tension, force, and the condition of the vessel wall. Even in all other medical hakim, they also read the pulse. The Islamic medicine is since quite ages, and they also have their pulse reading. As you know that pulse reading is very mystery. And when I was in medical school, they just taught us that this is Vata pulse, this is Pitta pulse, this is Kapha pulse. But I was hungry for this knowledge, this skill to read the pulse. And in India, there is one tribe called Vaidu. Vaidu means very old-fashioned Vaidya. They have not studied Charak, Shushrut, Vagbat. They just follow their own tradition, generation to generation, they read pulse. And near Pune, there is a Hadapsar area. There is a whole community of Vaidus. So I went there and I started that, please come and feel my pulse, I want to learn from you. They said, no. We are not going to give our knowledge to anybody. I said, why? He said, this is a sacred knowledge. This knowledge is our bread and butter. This knowledge is our life. And if I give this knowledge to you, then we will lose our client, we will lose our business, we will lose our bread and butter. And when he said like that, I just kept quiet. Oh, okay, can you read my pulse? Don't teach me. I will teach, I will read, but I will not teach. I said, okay. Then I observed how he is feeling the pulse. Muncha muncha dhrutva dhrutva, muncha muncha dhrutva dhrutva. Dhru means to hold, muncha means to leave. Press it, hold it, leave it, hold it, leave it. And he was smiling and he was making frown. And as he was feeling my pulse, I was feeling his impulse under my finger. Then he told my prakruti, my vikruti, my problem. Amazing. Then I made my own notes. Then I went to all other Vaidyas. They read their pulse. Every Vaidya has a different method, different technique. And even those Vaidyas, they don't want to teach their secret. Then I went to my spiritual teacher. And he is highly enlightened. He said, come here, sit. And I just sat in front of him. And he started reading my pulse. Then he asked me to read his pulse. And he said, you get that spike, it is Vata spike. You get that spike, this is Pitta spike. And amazing, my Guru has never gone to any Ayurvedic school. I don't know how he learned. You know what he told me? All knowledge come from here, third eye. He said, if you meditate, if you do pranayama, anulom vilom pranayama, soham meditation, and focus your attention, your Guru is within you. You don't have to go here and there. You will learn from your inner Guru, your inner awareness, your inner consciousness. Your consciousness is your Guru. Your awareness is your master. You have every information in your pure awareness. Wow. Then Guru told me this way, then I started using that in my practice. And literally started creating meaning. This is Vata pulse, this is Pitta pulse, this is Kapha pulse. And then, once you get a blessing of a Guru, your inner learning starts. And all that wonderful knowledge of 7 layers of the pulse, 7 dhatu, 7 chakra, all that kind. And I don't want to keep any knowledge secretive. It is just open book. There is no other book so well written, so methodically, scientifically, technologically written, because it is coming from my Guru's teaching. So even I have written the book, The Secret of Pulse, still it is Guru to me. Though I am the author, but I think I am a writer. and author is my teacher. Author is my guru, my master, my mentor. In India, we have a deep tradition between guru and disciple. Without guru, you cannot reach there. Gu means darkness, the ignorance. And Ru means light, the wisdom. So Guru is that highly enlightened master who dispels the darkness and unfolds the light of wisdom within you. So, I taught one seminar on reading pulse in Albuquerque. I was not sure how many people are interested. Because to do seminar, we have to consider how many people join, whether it is worth to do, only 5 people show, it will be expensive, then we cannot pay the rent of the hall, all those things. We have to see the practicability of running a course. And you will surprise. When first seminar of reading pulse happened, there were 300 people signed. And all our people, they were surprised. My God, there are 300 people coming from all different parts of the world, East Coast, West Coast, Canada, Washington DC, to Seattle, even people from South America, they came. And that pulse program became a hot cake. Everybody was interested in it. So, as we were doing this successful seminar, and we trained the student, and with the help of, we divided the people in a 10-10 group, and one student is in charge of that 10 student, because I literally cannot reach everyone. But finally, they will come to me for confirmation, affirmation, and this way, this seminar of Pulse become popular. And every year, during summer intensive, since last 3 decades, this Pulse seminar is sold out within few months. So, this is not my glory. This is the glory of my Guru. This is the glory of your Guru behind the third eye. So, you should do Anulom Vilom Pranayama. Inhale through the left nostril. Say silently, so. With so, inhale, hold the breath into the belly. And when you get swallowing reflex, means you are running out of oxygen, then open the right nostril, exhale out. Again inhale from the right side, so. Again hold the breath. So become Om in the pause. Again, when you get swallowing reflex, that means you are running out of oxygen, then hum. Suppose it took 5 seconds to inhale. Then retain it 4 times, 20 seconds, retain. And exhale slowly, double the inhalation, which is 10 seconds. So 5 seconds to inhale, 20 seconds to retain, and 10 seconds to exhale. If you do this alternate nostril pranayama with Soham meditation, but your attention is at third eye, your prana shakti will become your guru. That is why I did the prayer. Yontah pravesha mama vachamimam prasuptam. Oh prana, you enter into my breath, you enter into my heart, you enter into my nervous system. Yontah pravesha mama vachamimam prasuptam. Vach means speech. Vach means talk. Vacha means communication through word. So you made my unspoken word spoken, unexpressed thought expressed, unsaid sentence into said one. Yontah pravesha mama vachamimam prasuptam. I am speaking through the vocal cord. This speech is called Vaikhari. Vaikhari is abvocal speech. Then in the throat there is certain movement happening. That is invocal speech. When you are in a dream, you are talking to someone in the dream, there your vocal cord muscles move, but you don't say. So invocal speech is the language of dream. Abvocal speech is the language during wakeful stage. So Vaikhari, which is above the vocal cord, abvocal. Then Madhyama, invocal. Pashyanti, in the heart. Because behind every word, every thought, there is a great deal of feeling. So feeling is a language of heart. Feeling is a language of love. Love doesn't speak, but you can feel love. Feeling is a very spiritual thing. You feel devotion, you feel dedication, you feel commitment. So this is all the language of heart. And para at belly button is just a subtle vibration of celiac plexus, celiac ganglion. So celiac ganglion, celiac plexus behind the belly button is para. Para pashyanti madhyama vaikhari chari vacha kuntita zahali soham jyoti ubharali Guru Krupa. What a beautiful Guru Krupa. So all your four languages, para, pashyanti, madhyama and vaikhari, they become one through soham meditation. Sokare antarayati hankare bahi punaha soham soham hamsa jivo japati sarvada. So soham is a great ancient Vedic mantra. Soham is a natural supersonic vibration of mantra in every living beings in their breath. Even birds are singing soham through their breath. Even animals are singing soham through breath. All human beings, whether you are American, Russian, German, Italian, Indian, Pakistani, doesn't matter. Everybody is breathing, and in their breath, this is a supersonic sound. So soham is the mantra of galaxy. Galaxy is breathing. A decade ago, NASA scientists, they have very sensitive electronic equipments, and they heard the sound of galaxy. And you know what NASA scientists say? Hey guys, listen, the galaxy is humming. Soham, humming. So at that time galaxy was exhaling. So galaxy is breathing. So that is called cosmic pran, ambara piyusha pran. Right? Nabistha pran, pran at belly button. Rudistha pran, pran at heart chakra. Kanthastha pran, pran at throat chakra. Ajna pran, pran at third eye. And Murdnistha pran, pran in the crown. And above the crown, it is Vishwa pran. Vishwa means universal pran. So ancient Vedic wisdom is incredibly connected with all beings. We all are one. Though we speak different language, though we have different color, though we have different culture, we belong to human being. Humanity is the ultimate religion. the Hindu, the Muslim, the Christian, the Protestant, the Catholic, the Methodic, they did mess. Just brush aside all this religion. Come back to Soham. Because Soham is not a religion. Soham is your life. You must be there before religion happens. You follow? If you are not there, religion has no value. Who is saying I am Hindu? I must be there to say Hindu. I am Islam. I must be there to say word Islam. I am Christian. I must be there to say word Christian. So I, what is that I? That I is pure consciousness. I is eternity. I is immensity. I is universal consciousness. That is the meaning of Saha Aham Soham. So Soham belongs to all religion. Soham belongs to all breath. Soham belongs to all hearts. Because it is a life. You know, you eat roti, chapati, rice, and you add little salt. Salt is a sodium. That sodium belongs to ocean. You cannot say that this is Hindu salt, Muslim salt, Christian salt, Catholic salt, Protestant salt. The human mind is dividing. And where there is division, there is a conflict. I am not teaching any religion to you, okay? Word religion, etymologically, means to open the doors of all perception of life. Open the doors of perception to all departments of life so that your life become whole, and such a whole life is a holy life. That is religion. People, they call themselves religious people. How come religious people kill another person under the name of religion? That doesn't make sense. But it had happened in the history. They killed many human beings under the name of religion. So let us brush aside that past history. We should learn something from the history. History is to learn and to change our present life. Otherwise, what is the use of history? It is dead past. We should learn something from the history. And coming back to our dialogue, how to be in touch with your inner guru. Because this is very important. Boy, it has a sharp teeth like dinosaur. Oh, thank you. Dinosaur teeth. So, how we can be in touch with our inner guru, inner master? You are your guru. You are your disciple. There is nobody, third agency between you and your guru. That guru is your daily operating awareness. But we are never in touch with our awareness. Many people do not know that they are awareness itself. They say, oh, I am not aware, I don't know. No. You have not only awareness, you are awareness itself. But we don't know. Same thing with consciousness. This is my consciousness, that is your consciousness. This is my body, that is your body. This is my jacket, that is your jacket. This is my car, that is your car. Any outer object is mine and your. But look at the breath. Or perhaps you will say, this is my breath. And that is your breath. Okay, cute, I appreciate. You can say that. But come back to the awareness. The awareness that is operating in you, it is the same awareness is operating in everyone. There is no Hindu awareness, Muslim awareness, Christian awareness. Awareness is reality. Awareness is universal. Birds are aware, trees are aware, flowers are aware, animals are aware, cats and dogs are fully aware. That awareness is boundless. It has no quality. It has no label. Therefore, awareness is a God within you. When you are aware of your pure self, you are close to God. When you are not aware, you are far, miles and miles away from the God. So I learned this reading pulse with the guidance of my Guru, who directed me inside, and he told, your Guru is within you. No other Guru will tell you that. No other Guru tell you that your Guru is within you. They will say, I am your Guru, come on, touch my feet. No. You can touch anybody's feet, what a big deal. Touching feet is just symbolic. It is a symbol of simplicity, symbol of humbleness, symbol of surrender. We touch feet in India to the elderly people. So, in order to learn the skill of pulse reading, watch your breath. If you do this Anulom Vilom Pranayama, only 10 minutes, that's all. And then sit quiet and continue Soham meditation with this Suravi Mudra. This mudra is called Suravi Mudra. When you inhale, Ujjayi breath, increase the pressure. And when you exhale, release the pressure. Just do like this 10 breath. And a stage will come. You will feel the capillary pulsation in between the finger, thumb, index finger, middle, ring finger and pinky. If your pinky is working, don't read pulse because pinky is earth element. If water, the ring fingers are working, don't read pulse. Your reading will be 50% okay. But which fingers are very essential, very necessary? Which element? The index, the middle, and finally is ring. So when you do this breath, and when you feel the pulsation between the index finger, middle finger, ring finger, that's the good point you read pulse. This is a preparation for pulse. Then you grab your own wrist, behind the wrist, and fold the fingers. So index finger is distal, middle finger is middle, and ring finger is proximal. Proximal is towards heart. Distal is away from heart, and middle is in between. So like this, when you feel your pulse, then when you grab your radial artery, this is also proximal phalanx, middle phalanx and distal phalanx. Phalanx, proximal, phalanx, middle and distal. So distal phalanx is touching pretty close to the vertical, and then feel the artery. Then go deep, deep, deep and try to feel the pulse. This is one basic thing. Now, one thing you have to notice, this is your index finger. These three areas, heart is here. This is proximal curvature, distal curvature, middle curvature. The spike here, proximal curvature, is kapha spike. Sharp spike and under middle finger is pitta spike. And very delicate spike, distally, is vata spike. Means, delicate touch is vata. Sharp touch, pitta. Blunt, round touch is kapha. You follow? This is very important. So, this is index finger. Same thing is the middle finger. Here. Again I will draw middle finger here. Again proximal, distal, middle. Heart is here. Again blunt spike, kapha. Sharp spike, pitta. Delicate spike, vata. So what you have to do, go deep down over the radial bone, radial artery, and when you press, you go so deep that pulse disappears. Then slightly release the pressure. You will start feeling the pulsation. Now pay attention. Pay attention to the kapha site under ring, middle and the index finger. In my case, I have only one kapha spike under ring finger. Kapha is one. But under all three fingers, there is a sharp pitta spike. So my pitta is 3. And under 2 fingers, I get vata spike distally. So my prakriti is vata 2, pitta 3, kapha 1. This is very simple. Vata 2, pitta 3, kapha 1. This is prakriti pulse 7th level. If you are a woman, feel left hand pulse. If you are a man, feel right hand pulse. So, let us go to the Prakriti and Vikruti pulse and then we'll come to the Dhatu pulse. So, Prakriti pulse is the deep pulse, which is 7th level. It is your genetic code. It is your blueprint of constitution. And you are feeling deeply with a total attention. Just close your eyes, bring your mind to the ring finger, middle finger and index finger. Just pay attention to the kapha spike at kapha area, proximal area, under all 3 fingers. Out of these 3 fingers, ring, middle and the index, how many finger get kapha spike? In my case it is 1. You may have 2 or you may have 3 depending upon your prakriti. Then I switch my attention to the middle curvature, which is pitta site. How many sharp spikes are there? In my case, under all 3 fingers, at the middle central area, which is a pitta spike, at a pitta site, I have 3 pitta. Then again I switch my attention to the distal area away from the heart. Distal area spike is the site of vata dosha. So in my case, my prakriti is vata 2, pitta 3, kapha 1. Okay? And you read your pulse, write down your observation, come here one by one, and I will read everyone's pulse and give you your prakriti again. So we share together the art of reading Prakriti. The deep pulse corresponds to Prakriti, which is your original constitution at the time of fertilization. And that is your genetic code. All the spike, which is round, blunt, proximal spike, is kapha. At the central curvature, sharp spike is pitta. And distal curvature, very gentle, delicate spike is vata. So these are the quality of spike. Pulse has a spike. Spike is pulsation. And pulsation creates uplift. Pulsation creates spike. And these are the side, kapha, pitta, vata, kapha, pitta, vata, kapha, pitta, vata. And what we did, we just went deep down and tried to feel these spikes and count. 1 is low, 2 is moderate, 3 is much more. So figure 3 represents predominant dosha. Number 2 represents secondary dosha. And 1 is the tertiary, the third dosha, the lowest dosha. Apparently it looks that 1 is high and 2 is secondary and third is... No. It is reverse. Because we are doing gradation. This is the ratio. 1 to 2 to 3. In my case, 2 to 3 to 1. So this is the ratio of Prakriti. Because all molecules of Vata, Pitta, Kapha are circulating through the bloodstream. And when you put your fingers, so what happens? Vata spike is a sneaky, goes through that and expand, but create delicate pulse spike at distal. Pitta, moment resistant becomes sharp, because Pitta is sharp. So it creates central spike. Kapha is so dull, so slow. It doesn't resist, it's just stuck here. So Kapha spike is dull, Pitta spike is sharp, Vata spike is delicate. And this is the very important criteria to determine under all 3 fingers how many Vata, how many Pitta and how many Kapha. Now we will apply same corollary to the 5th level pulse, which is called Dhatu pulse. Dhatu pulse, 5th level pulse. So Dhatu pulse, the fifth level. So from superficial, if you give gentle pressure, the spike changes, that means you are in the second level, third, fourth and fifth. Don't go too deep, don't be so superficial. And then, at each site of the finger, there is a site of Dhatu. So here, this is ring finger, this is middle finger, and this is index finger. So this is Rasa, Rakta, Mamsa, Med, Asti, Majja, and Shukra Artava under age. Rasa, Rakta, Mamsa, Med, Asti, Majja, and Shukra Artava under middle. Shukra Artava. Artava. Both are Shukra Artava. Shukra Artava. Shukra is male reproductive tissue. Artava is female reproductive tissue. Same thing on this side. Boy, this flip chart is a flood affected. And it has many dents and bends, so this is ring finger, this is middle finger, this is index finger. Rasa, Rakta, Mamsa, Med, Asti, Majja, oh my God, and Shukra Artava here. Shukra, S for Shukra, A for Artava. So the Dhatu which is absolutely normal doesn't create spike. But the Dhatu which is affected by dosha will create a spike. This is a very profoundly beautiful pulse, the fifth level pulse. And when I'm feeling the pulse on my right hand side, I'm going to the fifth level. This is 1, 2, 3, 4 and 5. Even I'm not looking at the pulse, just I'm feeling my index finger, middle finger, ring finger. Under ring finger, distally Rasa Dhatu. Proximally Rasa Dhatu, distally Rakta. Under middle in ring finger, proximally Rasa Dhatu, distally Rakta. And I'm not paying attention to the central. Then under middle finger, proximally Mams, Meda, distally. Under index finger, proximally towards heart is Asti and Majja. So I'm going. My Rasa is okay, doesn't create spike, Rakta is okay. My muscle is achy, I'm traveling such a long distance, I have shoulder pain. I am in pain, you cannot see. And my Mamsa Dhatu has a spike. And the nature of the spike is Vata, it is delicate. So I have Mamsagata Vata. Then Mamsa Meda is okay. Asti also has Vata spike. So I get little pain in the joint. My rest of the dhatu was okay because of traveling from India to here, sitting in the plane, not sleeping properly. So I have neck pain, shoulder pain. I have Vata in the Mamsa. And I have pain in the joint. I have Vata in the Asti. My rest of the dhatus are okay. You got it? It is so simple. Oh my God.
How to be sure that we're at a 5th level and not 4th
Please
level?
come here. Camera will film us. And it is a great honor to film with you in front of the camera. Okay. This is right, this is left. Now the question is, how do we know that we are 5th level? See, this is superficial, huh? Your superficial is very superficial. Because she has less subcutaneous fat. Then I'm just slightly pressing. See how much press I'm giving? I'm in the 2nd level, 3rd level, 4th level, and 5th. Now, rasa, rakta, mamsa, meda, asti, majja. Your rasa is healthy, but your rakta dhatu has pitta. Rasa, rakta, mamsa, meda, asti, majja. And there is a kapha in the artha, you might be ovulating or just finished menstruation. Right? I should not talk about that, but I'm sorry, I should not say that. Well, this is most private thing, But while reading Pulse, spontaneously I said something. I expressed my apology that I should not talk about your artava publicly. Privately, it's okay. So you got now how levels are.
It's quite subjective, isn't it?
Huh?
According to the person.
Yeah, that's why you don't pay attention to the level. Just pay attention to the spike. Moment give pressure, spike changes, the level changes. Level 1, 2, 3, 4. Spike changes. Okay? Now let us try. TRY, try. These 3 words are great, yeah?
Is it always left hand for women and right hand for men?
Yeah. Left hand for women and right hand for we men.
On that similar question you just asked, we were talking here, is it possible sometimes women who maybe have more male energy, it's easier
Wow,
to feel...
this is beautiful. Come here, sweet. She is a good yogini. Amazing. She is a great yogini. What will happen at that time? You know her question? Though ideally you should feel the left hand pulse in the women and right hand the pulse in the men. I just out of joke, women and women. But she had asked question, if some women have male energy, then what will happen? If a woman has male energy, then feel the pulse on both sides. If you have male energy, your right side will be prominent. If you are very feminine, your left side is prominent. She is a good yogini. She does wonderful yoga, teacher, right? So, but still she is feminine. You are very feminine. So, am I answering your question?
Yes, thank you. And so it's okay, and for men as well, maybe men who are a little bit more feminine? So
correct.
So we can do...
So just because prana is moving to female side, ida nadi, then left pulse will be prominent in man. Prana is moving to the pingala nadi, then right pulse will be prominent in the women. So she is right, yeah.
So will that be also, should we also consider which nostril is round?
Oh, that is very postgraduate pulse reading. Postgraduate, yeah. That's very good.
Like you said that when there's no spike, there's no problem in the
Correct.
But there's always a beat somewhere.
Of course, always there is a spike in some dhatu. That means the vata dosha, pitta dosha and kapha dosha. Kapha in the chest, vata in the intestine, pitta in the intestine, vata in the colon. These doshas are moving from the GI tract to the periphery, periphery to the GI tract. In that journey, if the dhatu avanis are weak somewhere, dosha will get entrance into that dhatu and that will make spike under the pulse. Am I making sense?
It's just that when we feel there's always an activity in that fifth level.
Yeah.
So how to recognize which one is the unhealthy dhatu problem and which is the regular beat in there?
If the spike of pitta is strong in rakta, that means definitely there is a high pitta in the rakta. Yeah, it is the strength of the pulse. Then that person will get hives, rash, urticaria, bleeding disorder.
Sometimes pulse is really, really quiet. You can hardly feel it. Does that mean that person has low energy or the pulse is not?
You know, when pulse is very quiet, no energy, that means there is a cellular dehydration, hypotension, low BP, adrenal fatigue, adrenal insufficiency, and fasting. If you are fasting, you are sinking. So, yeah.
When you're doing an assessment, even with the face, is there a difference for somebody who's left-handed, right-handed? Does that make a difference?
Left-handed, right-handed is a neurological habit. Ida Pingala Sushumna is a spiritual pathways of the pranic energy. So, when you watch, when Pingala is strong, then female energy is strong. When Ida is strong, then female energy, and Pingala is male energy. And if Sushumna, then neutral. But if the person is right-handed, and if she is a woman, that doesn't mean you have to feel her right pulse. Always pay attention to the pulse on the left-hand side for Prakriti and Vikruti paradigm. There are certain areas where we can check the pulse on both sides. Okay? So, yeah.
Is there any difference when you measure or when you feel the pulse for children? Is there anything?
Oh, their pulse is so cute. You have to use 1 or 2 fingers. No, their pulse is so small. If you put 3 fingers, your finger will go to the ankle. So just use 1 or 2 fingers. So, just think over it and drink a cup of chai and then come to have wonderful discussion. After chai, you will fly high. So this is a scheme of the circulation of 7 dhatu from the GI tract. The end product of digested food, microchyle, is circulated by Vyana Vayu. Then it goes to the rasa dhatu. It becomes permanent rasa then it creates next impermanent dhatu. The permanent dhatu is called sthai. Sthai means stable and asthai means unstable. So asthai rasa through the heart it is carried to the sthai rasa, and these red dots are agni, rasa agni, rakta agni, mamsa agni. So rasa agni will act on asthai rasa to convert into sthai rasa and asthai rakta, and malarup, kapha dosha and upadhatu, stanya and raja. This is whole the scheme I have explained in my several other books, that this is called dhatu poshana, the nutrition of bodily tissue. So rasad raktam tato mamsam, mamsad medo tato asti, asti majja tata shukram, shukrat ojam prajayate. This is rasa raktam mamsam asti majja shukra artava, and final is ojas, and ojas come to the heart. So this is a wonderful scheme of nutrition of the bodily tissue. Now, as we were reading the 5th level pulse, so 5th level pulse, the dhatu pulse, the 5th level pulse. So healthy dhatu doesn't create spike, because healthy dhatu has a good agni. If vata make the agni impaired, then vata will have entry into the rasa dhatu. If rasa dhatu agni is strong, then no dosha will enter into rasa dhatu, it will go to the next. So we don't want to have only healthy dhatu, but we want to have healthy agni, the metabolic fire, the digestive fire. So this 5th level pulse talk about the condition of dhatu agni. We have jatara agni, the central fire, agni in the liver, the bhuta agni, and agni in the dhatu agni, and agni at cell membrane level, pilu agni, and agni at nucleus level, RNA, DNA, that is pitara. Pitara means parents. Pitara means genes, genetic factor. So, the 5th level pulse shows the condition of dhatu agni. If dhatu agnis are strong, dhatu will be roasted and toasted and emaciated. Then vata will or pitta will go there. If dhatu agnis are low, then there is undue raw tissue production. So if kapha goes into the meda agni will become low and person will develop raw adipose tissue. It will lead to obesity. It will lead to adiposity. Adiposity, obesity is nothing but manda, low, meda dhatu agni. Same thing, if vata is high and vata will make asti agni vishama, irregular, therefore it will affect bone metabolism. So bone will be losing calcium. It will lead to osteoporosis, osteopenia, which is nothing but degeneration of the tissue. So at 5th level, we are understanding. First understand which dhatu agni, means which agni shows us the spine. According to this picture, ring finger proximally rasa, distally rakta. Middle finger proximally mamsa, distally meda. And index finger proximally asti and distally meda. While centrally, under all these 3 fingers, is shukra artava shukra. Now, what happens? In my case, I flew from India It is about 8 to 9 hour journey. Flying high in the sky provokes Vata dosha. Sleep was not there, interrupted. So muscles were twisted, bones were stuck. So because of traveling, my Mamsa Dhatu Agni was impaired, Asti Dhatu Agni was impaired, and Vata entered there and create a spike in the Mamsa and Asti Dhatu. This is my interpretation. Then I have to take care of my Vata dosha. Then I can take Yogaraj Guglu for muscle pain and Pravan Panchamrut for Asti. That is why for every clinician, physician, the Dhatu pulse, the 5th level pulse is absolutely necessary. Okay? Again, same principle. If you get a spike, then whether the spike is sharp, Pitta, spike is light, Vata, spike is dull and blunt, Kapha. So now, take a new paper and read your own pulse. If you are a man, read your right hand pulse. If you are a woman, read left hand pulse. And try to understand. Go to the 5th level. Try to understand whether spike is under index finger, middle finger, ring finger. Ring finger proximally Rasa Dhatu, distally Rakta. Under middle finger proximally Mamsa Dhatu, distally Med. And under index finger proximally Asti Dhatu, distally Majja Dhatu. And under all 3 fingers centrally is Artava Shukra. And when you complete your reading by and by, you come here and I will read and we will compare between your reading and my reading, yeah?
Is it easier to push down to the 5th level or come up from the 7th to the 5th?
Ideally, it is better from level 1, you can go to the level 2, then level 3, then level 4, and level 5. It is easy to go deeper.
Lady's got a question. She's got a question.
Yeah.
She's got a question.
Question.
I just wanted to ask, is there any explanation why we feel the dhatus on the different locations? Like why is this rasa, why is this Majja? What is the explanation of the location, why we feel the dhatus?
Very
here?
beautiful, very beautiful. Come here, I'll show you. That's why I have drawn this picture.
Mm-hmm.
The first is Rasa, Rakta, Mamsa, Meda, Asti, Majja, Shukra. Now, Rasa is Kapha.
Mm-hmm.
Then Rakta, Mamsa is Pitta. Then Asti, Majja is Vata. So, here, this is ring finger, Kapha finger, Rasa Rakta, Pitta finger, Mamsa Meda. Then Vata finger, Asti Majja, and Shukra Artha circulate throughout the body. Good.
So Claire, how can we understand when if it is kapha or avarana or tamas?
Please come here. Can you announce your question once more?
Yeah, it's how do you differentiate whether if you understand, if you feel a kapha, you seems like a sthira, sthira type of pulse, and then you, how can you differentiate whether it is because of avarana or is it because of tamas or?
Correct. So you are talking about spike.
Yeah.
So how do I feel that it is a Vata spike or Pitta spike or Kapha spike? At 5th level.
Yeah.
So I'm going to go to the 5th level. So this is level 1, 2. See spike change. 3, 4, 5. Now, this is Rasa, Rakta, Mamsa, Meda, Asti, Majja, and Shukrata and Raw. Now, Rasa is fine, there is no spike. Rakta is fine, there is no spike. Mamsa has a Vata spike. It is a delicate.
Okay.
Meda has Kapha spike. So there is Kapha in the Meda. Then Asti Majja. You have Vata spike in the Asti. So you get cracking of the joint, popping of the joint.
Yeah.
And because of Meda, you can easily put on weight. Even if you breathe air, it will become fat. I'm sorry.
I'm not talking about myself.
No, I'm just giving an example. So that means the spike is, if the spike is delicate Vata,
Okay.
spike is round, blunt, Kapha, spike is sharp, Pitta.
Okay, so for if there is Avarana also, like
In Avarana, what will happen?
Yeah.
Suppose I get a Kapha spike in the male.
Okay.
Sometimes what happens, Vata spike go to the Kapha side. That means Vata is covering Kapha. Or Vata is pushing Kapha. She is a bright person asking wonderful question. So before I sit, let us answer the question. Any question?
Is it significant that it's 5th level for the Dhatu? Why would it is like Vikriti 2nd level Dhatu? The levels corresponding to, is there any significance why?
Because Prakriti is deeply rooted into your genetic code. So deep pulse correspond to the genetic code. And Vikruti comes to the very superficial level. So Vikruti dosha come to the level 1. But in Dhatu, which is the 5th level, Rasa, Rakta, Mams, Med, Asti. So at the 5th level, it is a Dhatu pulse, and generally healthy Dhatu doesn't create spike. If any dosha is long lingering in a particular Dhatu, it will create spike. So that's why 5th level corresponds to the Dhatu. Why it is so? Am I making sense?
Because like Manu is 7,
Uh-huh.
6
Yeah.
1, so
5th level is Dhatu pulse.
and then 6th one is Manu.
6th one is Manas Prakriti.
So, for example, why would the Dhatu be 5th and Manas 6th? Is there an explanation to that?
You know, first, when we were born in the mother's womb, first a zygote is formed. So zygote is embryonic body, physical body in the form of embryo. It is pulsating, throbbing. Then slowly, 3rd month, the mind is developed. 3rd month. So first 3 months, we are in a zygote form, multiplication happen, mitotic division happen, the structure, the brain, the spine, the ribs and the heart, all these vital organs are happen. But mind is not yet functioning. At the 3rd and 4th month, mind is expressed. Therefore, deep level 7th is physical Prakriti, 6th level is Manas Prakriti. Right? Huh?
But you said that when the Shukra gets to the heart, then it becomes Ojas.
No, Shukra becomes Ojas and then goes to the heart.
And what happens to the Ojas when it gets to the heart? What happens after?
Then it becomes cardio-electrical potential. Pacemaker, SA node, AV node and bundle of his are received cardiac impulse, And that's when all cardiac activity happens. So Ojas maintain the heart. If Ojas depleted, person suddenly die of heart attack. Right? So confusion is reality. If you are confused, be completely confused. And pay attention to the confusion. And confusion will become clarity. Remember, clarity is not opposite of confusion. Confusion becomes clarity because of awareness. So I was amazed, many students were absolutely right. So this fifth level needs more practice. So throughout the year you just do practice fifth level, Prakriti level, fifth level, Prakriti level, Vikruti level and fifth level. And next year when I come you will be totally enlightened. You will be great in pulse assessment of the pulse. So healthy dhatu has no spike. Any spike failed in the dhatu pulse indicates that dosha has entered or just brushing or touching that dhatu. If it is just touching, you may not get symptom. But when it enters, you will get symptom. So, what is the significant meaning of rasa dhatu with vata pitta kapha? Vata spike in the rasa indicates dehydration, cellular dehydration. Dry skin, poor circulation, cold skin, blackish, brownish discoloration of the skin. Because skin, topmost layer of the skin represents rasa dhatu. So whenever you get vata spike in the rasa dhatu, these possibilities are there. There is a brownish dyspigmentation, poor circulation, cold, dark, cold skin, dehydration, and sensitivity to the sound. Rase rauksham tramaha shosho glanir shabda sahishnuta. Glani means fatigue for no reason. At 4 o'clock you get tired. You are waiting for high chai time. That is vata in the rasa. You got it? Pitta in the rasa may create hives, rash, urticaria, hot flashes, or just feverishness, acnes, and hot flashes, or skin becomes sensitive. And kapha in the rasa dhatu may indicate lymphatic congestion, or water retention, or a dermoid cyst, or kapha type of allergy, cold, sneezing without wheezing. Sneezing with wheezing is asthma. Sneezing without wheezing is allergy. So these are simple possibilities of 3 doshas in the first and foremost important dhatu called rasa. You got it? Any other question? Any confusion, illusion, delusion? Okay. The second dhatu is rakta dhatu. Rakta dhatu, vata in the rakta dhatu may indicate low blood pressure. poor circulation, mild anemia. But what type of anemia is hypoproteinemic anemia? Hypoproteinemic anemia, dizziness, vertigo, and cardiac arrhythmia, extrasystole, or gout. Gout is vata in the rakta, vata rakta. Increased uric acid. Pitta in the rakta, bleeding disorder. Gums are bleeding while brushing the teeth. Hives, rash, urticaria. And pitta in the rakta can create eczema, psoriasis. Autoimmune skin disease is psoriasis. Nowadays, autoimmune disorders are quite common. Previously, they were uncommonly common, but now they are becoming commonly common. Because our immunity is challenged by our diet. And kapha in the rakta create high cholesterol, high triglyceride, diabetes, hypertension, increased blood sugar. So these are the possibilities of entry of 3 doshas in the rakta dhatu. Then third dhatu is mamsa dhatu, under middle finger. Vata in the mamsa, muscle tics, muscle spasm, muscle fatigue, muscle tremors and muscle atrophy. These are serious. But just muscle aches and pain, vague pain in the muscle is vata in the mamsa dhatu. Pitta in the mamsa dhatu, bursitis, tendinitis, fibromyalgia, hemorrhoids, and uveitis. You know uveitis? No? You know uvula? Teeny tiny tongue hanging in the throat. That get inflamed. Uveitis. Uveitis. Not vulvitis. Vulvitis is inflammation of vulva, the genital passage. But uveitis is inflammation of uvula, which is a pitta disorder. And kapha in the mamsa may create tumor or muscle hypertrophy, dermoid cyst, or fibrocystic changes, fibroma, like uterine fibroid tumor, mamsa in the kapha in the mamsa. Then next dhatu is meda. Vata in the meda is emaciation, lack of lubrication, dislocation of joint, and weak ligament. Meda dhatu has important function to hold the tissue in their situ. Tissue in situ. You know that word situ? Situ is their anatomical position. I love that word. Tissue in situ, meda dhatu. If meda is depleted, tissue get displaced. Then you will get floating rib, or you will get floating kidney, or you can get megacolon. So meda. Pitta in the meda create inflammation of the kidney, adrenal, fatty degenerative changes in the liver, boils, and pitta in the meda can cause gallstone or cholecystitis, inflammation of gallbladder. Then kapha in the meda, multiple lipoma, fibroma, fibrocystic breast, then renal calculi, gallstone, sebaceous cyst, and hydronephrosis, polycystic kidney, kapha in the male. These are a horrible condition, but they can be read through the pulse. And Asti Dhatu, under index finger, Vata spike, cracking of the joint, popping of the joint, osteoporosis, degenerative arthritis, brittle hair, brittle nail, and ringing in the ear. High Vata in the Asti can create buzzing ear or tinnitus. Pitta in the Asti Dhatu can create periostitis, alopecia, loss of hair, patch of hair loss, repeated fungal infection in the nail, in the teeth, and in the teeth abscesses. And finally, kapha in the Asti Dhatu create osteoma, swollen joint, effusion, deformed nails and the bones. Then finally is Majja Dhatu. Vata in the Majja, tingling numbness, loss of sensation, insomnia, hyperactivity, strabismus means crossed eyes, ptosis, drooping of the eyelid. Ptosis is third cranial nerve paralysis, which is drooping of the eyelid. Pitta in the Majja create demyelinating disorder, multiple sclerosis, neuritis, meningitis. These are very serious conditions. Encephalitis, they need hospitalization. Sciatica, but on regular level, optic neuritis, which can lead to MS, multiple sclerosis, or long lingering pitta in the Majja can cause schizophrenia. So, Majja Dhatu problem can affect the brain. Then finally, Shukra. Vata in the Shukra under index finger indicates low libido, premature ejaculation, and oligospermia, scanty little sperm. Under middle finger, Pitta in the Shukra Dhatu can create prostatitis, epididymitis, architis, or in case of woman, miscarriages or birth control pill. In case of Vata in the Artava, dysmenorrhea, amenorrhea, or early menopause. And finally, Shukra and Artava with Kapha. Kapha in the Artava create benign prostatic hypertrophy, prostatic calculi, testicular swelling, hydrocele in the man, and in woman, polycystic ovarian syndrome. So these are all different varieties of conditions possible, but don't suddenly jump to the wrong conclusion. Oh, I have this and I have that. You know, doctors and nurses are worst patients because they have knowledge. And because of knowledge, they always think, oh my God, hope it is not cancer. Oh my God, hope it is not MS. I just enjoy my Soham meditation. So anything happens, Soham will take care. So this is the best way to live with full knowledge and not to suffer from knowledge. Otherwise, I have seen medical nurses, medical doctors Healthcare takers, they are worst patient. Because knowledge, they always think about all serious possibilities. And really, they suffer. So dear friend, it was a short and sweet talk to the Dhatu Pulse, 5th level. If you like, you can take the picture of this beautiful picture so that you will have notes with you. And we will continue our seminar tomorrow. Till Saturday we are continuing. So thank you for your visiting and thank you for showering a benediction on the heart of the speaker. Namaste. Oh.